Before your appointment today, we'd like to take a moment to help you make the most of your visit to the doctor. Even if you're only here for your annual exam, you should know that you're encouraged to discuss any eye-related questions you may have, whether or not you think they're important. Nothing is ever unimportant where your eyes are concerned. For example, let's talk about dry eyes, a problem some people consider minor, or at worst, a nuisance. But it's more than that. The symptoms vary from person to person and include a stinging, burning sensation, a gritty or sandy feeling in your eyes, sensitivity to light, excessive tearing, blurry vision, and feeling like something's in your eye. Normally, your tears help keep your eyes from feeling dry. Every time you blink, your eyes make a natural tear film that keeps them moist, protected, and clean, and helps sharpen your visual clarity. Your natural tears aren't just water. They contain nutrients, electrolytes, proteins, and lubricants to help keep your eyes healthy. But if your eyes don't make or maintain the right quality or quantity of tears, the tear film can break down, creating dry spots on the surface of your eyes. When this happens, your eyes can become dry and irritated, and that's what happened to these people. We'll let them tell you about it.
My eyes aren't just dry. There's always this gritty, stinging sensation. I'm using artificial tears more and more, but the relief doesn't last. I'm constantly blinking and rubbing my eyes. People ask me if I've been crying.
On top of the grittiness and stinging, my contact lenses sometimes don't feel right. My eyes get dry and make it difficult to read long documents or work at the computer for long. And driving at night can be challenging because of the glare of lights in my dry eyes.
No doubt about it. Performing certain activities and tasks can be limited by your dry eyes. They affect such everyday things as reading, driving at night, watching television, working at the computer, even wearing contact lenses. But these situations may be more than just uncomfortable. When the tear film on your eyes breaks down, this can be a sign of a disease called chronic dry eye. It's important to talk to your eye doctor because this disease may cause potential damage to the eye's surface, or the cornea, that may affect your vision.
My eyes are uncomfortable, but I never thought that I might have an actual disease, something that may have potential consequences. What could be the cause?
Chronic dry eye can be the result of one or more factors, and it affects men as well as women. Leading causes are the aging process, inflammation, hormonal changes, thyroid or vitamin deficiencies, certain medical conditions, and medications. Environmental factors can further aggravate chronic dry eye symptoms. It's important to tell your doctor or technician about any dry eye problems you have. They can perform some tests to determine if you have chronic dry eye. At this time, there's no cure for chronic dry eye, but there are treatment options that you can discuss with your eye doctor. These include artificial tears that provide temporary moisture to your eyes, prescription therapies that can only be prescribed for you by your eye doctor, or tear duct plugs that can be inserted by your doctor to close the ducts that drain tears from your eyes. Your doctor and you can determine options that are right for you. So if you're experiencing any kind of dry eye problems, ask yourself these 6 questions. Are you using artificial tears often? Has your use of artificial tears increased over time? Do you experience sensitivity to light, eyes that feel gritty, painful, or sore eyes, blurred vision or poor vision? Do your dry eyes limit your ability to read, drive at night, work on a computer, watch TV, or wear contact lenses? Do your dry eyes interfere with any of your leisure or work-related activities? Would you like to discuss treatment options with your eye doctor? If you answered yes to any of these questions, speak up and discuss your answers with your doctor or technician before the examination. Tell them what you're going through, just as these patients did.
I'm glad I discussed my dry eyes with my doctor. She tested me, and sure enough, I have chronic dry eye. She showed me their treatment options.
As you've just heard, it's helpful to discuss your dry eye issues with your doctor. The health of your eyes is very important. Talk to your doctor about chronic dry eye disease. Thanks for watching. Have a great day.